trio of new reports just out from the CDC, offering the very first look at how COVID vaccines hold up against the Omicron variant. And the data paints a pretty clear picture of how crucial boosters are, protecting people far better against this particular variant than just the two-dose regimen. The reports showing that those with booster shots offer a better chance for staying out of the hospital if they become infected. The studies also come at what could be another critical turning point in the pandemic. Almost half of the country now reporting declining cases, with some more glimmers of hope that the surge has passed in the Northeast, but still hospitalizations are on the rise across much of the country. And there's also this, which reinforces what everyone knows by now. New data showing COVID hospitalizations are nearly 50 times higher among unvaccinated seniors compared to those who've been vaccinated and boosted. CNN's senior medical correspondent Elizabeth Cohen's joining me now live with more on this breaking news. Elizabeth, what are the details from these three reports out from the CDC just now?
Kate, this is really exciting because if you remember last fall, you and I had so many discussions. Do boosters work? Don't they work? Should we be boosting the entire population? Now there seem to be answers. These are three huge studies, and I usually don't use that word, but these are huge studies, and they're not in a press release. They are actually published. So let's take a look at what these three studies found. So in the first one, CDC researchers looked at booster effectiveness at preventing Omicron hospitalizations. They found that boosters were 90% effective at preventing hospitalizations, and that two shots were only 57% effective, and that's looking at 88,000 hospitalizations in 10 states. Now let's look at booster effectiveness at preventing Omicron ER and urgent care visits. They looked at 200,000 visits in 10 states. Boosters were 82 effective, two shots, just 38% effective. Now, lastly, let's look at booster effectiveness at preventing Omicron illness, just from getting sick with Omicron. So they looked at 13,000 cases. They found that the odds of becoming sick with Omicron were 66% lower than for people who had a booster versus two shots. And just to remind everyone, here are the rules about boosters in the United States, because they sort of changed around for a while last fall. So the rules are, the recommendations are, I should say, that everyone should get a booster, ages 12 and up, and that you get them 5 months after your second shot. However, less than half of those who are eligible for boosters have gotten boosters, and only 0.25% of the total population is fully vaccinated and boosted. So, Kate, again, all of these results are in the age of Omicron. It's not Delta, it's Omicron, which of course is, at least 99% of what's out there. And it certainly begs the question, should the CDC be changing the definition of fully vaccinated from 2 doses to 3? Kate?
Great to see you, Elizabeth. Thank you for that information. Joining me now for more on this is CNN medical analyst, Dr. Lena Wen. Dr. Wen, the first CDC study is really out, really showing information, concrete data about how vaccines are holding up against the Omicron variant. Real data saying that boosters, they are key to keeping people out of the hospital. What do you see in these reports?
These new studies should erase any doubt about the importance of boosters at this point in the pandemic. I think there's been, unfortunately, so much muddled messaging that made it sound like boosters are a nice to have rather than something that's really essential. But these studies show definitively that boosters reduce illness and the chance of contracting COVID and therefore being able to give it to others. They also, very importantly, protect against hospitalization and severe illness, severe enough to cause you to go into the ER and to be in the hospital. And so I think it's time for us to change our policies. And by the way, this is not unusual. There are plenty of other vaccines that require 3 or 4 doses. Hepatitis vaccine, for example, is a 3-dose vaccine. Polio vaccine is a 4-dose vaccine. It's time for us to acknowledge that the COVID-19 vaccine is at least a 3-dose vaccine. And I wish that's something that the FDA and CDC will very quickly revise in their definition.
Well, and this gets exactly to a conversation I know that we've had for a long time, and the debate that has kind of been going on amongst the medical community, public health officials over the definition of fully vaccinated. I just want to play for you what Dr. Anthony Fauci told me. It was back in the beginning of December about this. Is it a matter now of when, not if, the definition of fully vaccinated changes?
You know, my own personal opinion, Kate, is what you said is correct. It's going to be a matter of when, not if.
And yet that still hasn't happened yet. Why do you think that is? I know you think it should change, Dr. Wen. Why do you think it hasn't?
I can only speculate. I think it might be bureaucratic red tape, and that is not an acceptable answer in the middle of a public health crisis. There are a lot of patients, Kate, who are so confused. I mean, I see my own patients who are confused about whether they should be getting a booster. They heard mixed messaging earlier. They heard that there's some disagreement within the scientific community. They're not seeing this as something that they have to do to protect themselves and others around them. If the definition changes on the federal level, it will help a lot because it'll also help businesses, universities that are making their own rules about what it means to be vaccinated. But I also hope that doctors, hospitals, pharmacies will take matters into their own hands, and if they haven't already, call their patients, not just elderly patients in nursing homes, but all of their patients who are eligible for boosters but haven't received them, because that is more than half of Americans who are fully vaccinated as of the current definition, but have not yet gotten their boosters, even though they are eligible and now overdue for their boosters.
It does seem in that approach that you're talking about does seem also the most effective way to convince people to do that. Outreach from their own care providers seems to be one of the things we have learned in this pandemic. Looking at those numbers you were just getting at, only about a quarter of the U.S. population is fully vaccinated and boosted. So if this definition changes, the country has a long way to go again. How do you tackle that? Especially when if we're very honest about where we are here, right? An exhausted nation by the pandemic, which has, quite frankly, pushed some people to tune out a lot of this.
I actually think that it will be easier to convince people to get boosters than to convince those people who are still unvaccinated to get their first shots. Think about the individuals, the adults who remain unvaccinated. At this point, the majority of them, it'll be very, very difficult to change their minds. But if people got their initial 2 doses, there are a lot of people who are convincible, who are able to be convinced to get that 3rd dose if they get the accurate information, which is something that we as a medical community, and in particular, I hate to say this, but the Biden administration, and in particular the CDC, they've had a lot of mixed messaging. Actually, the Biden White House with Dr. Fauci and Dr. Francis Collins and others were correct back in August when they said that they believed everybody should be getting a booster shot starting that September. But that messaging got so confused. And so I actually think that we can do this. I know people are sick and tired of hearing about COVID, but if getting the booster dose is what allows everybody to move on with their lives, I think those who are vaccinated are ready to hear that message.
And there's some new concrete data out today showing just how important it is. A lot of people should be pouring through this. Great to see you, Dr. Wen. Thank you very much.